Good morning, sir. My diagnosis is bilateral osteoarthritis of both bilateral osteoarthritis in of the knee in a patient aged 55-year-old female with obesity.
Yes.
Any other comorbidity, diabetes, hypertension,
With hypertension.
and hypertension. Why do I say so? Because there is bilateral knee pain with loss of function, which means bilateral antalgic gait, since
6 years.
6 years in an obese patient, possible BMI is 30, 38. On examination, hypertension is confirmed. Otherwise, general examination and systemic examination is non-contributory. There is no other joint pain,
Yes.
or bone tenderness. Parity is P
Stimuli ability.
this plus this, okay?
Yes.
Youngest child is, so this speaks of load on calcium and chances of postmenopausal osteoporosis. No other joint, no other bones are tender. Right? On local examination, knee flexion, extension restricted, no swelling around knee, right sided bilateral genovarum, peripatellar tenderness, ligaments, that means cruciates and collaterals stable. Apple's grinding test, positive in terminal extension, crepes present. Involvement of right is more than left. Right? Genu varum. Patellar grinding is painless. Popliteal foci are free. No neurovascular deficit. Okay.
Deformity.
Weight
Deformity के बारे में नहीं बोला.
70 kg. 70 kg.
Yes, sir.
Height 5 feet 2 inches. My diagnosis on basis of these findings is bilateral primary osteoarthritis knee with genu varum and peripatellar tenderness. Then he asked why primary?
No history of trauma, previous infection.
No history of previous knee injury or disease. Any DD? Any DD? No. How would you manage? Investigation, height, weight, blood pressure, pulse, respiration. Then X-ray of both knees, standing AP, sunset view and lateral. We will show you the X-ray. This is the X-ray. Sir, in this X-ray, I find that there is genu varum on the right side as compared to the left. If I draw a line, then if this is the
Wrong axis of this.
this is the this is the femur, and this is the tibia. ये बना कैसे गई?
इसको हाथ हटा के देखिए अब ठीक
This is the tibia. Angle here is 82 and the angle here is 84. So there's about 2 degrees of varus. Normally there should be about 6 degrees of valgus. And if we do the same thing on this side, though it is not exactly the AP view, then this is 83 to 78.
5 degree.
Eh? 5 degree. Therefore, there is 5 degree valgus on this side and 3 degree
2 degree.
or 2 degree
Paris.
2 degree varus. Also, as compared to the left side, you find these multiple shadows which may be detritus, and you find this osteophyte. And you find that though the knee joint space on the left is equal on the medial and lateral side, the knee joint space on the right side is reduced, and this reduction is because of rubbing off of the cartilage. So, after this, what do we do? We say done. After understanding this X-ray, supposing I ask you, what is the lubrication of normal cartilage? Cartilage. So, the structure of normal cartilage is that there are, in the lacunae, there lie chondrocytes which are paired cells. They secrete substance which is the matrix. So they secrete matrix, and if you try to understand this matrix, if this is the bone, then this matrix has got collagen fibers arranged in an arcade. The arcades are more vertical as they approach the bone, but they become less and less vertical as they approach the surface. Now this is basically collagen 4, and gradually in the elderly it gets replaced to collagen 6. Now, if this is a strand of collagen, on this is attached an acid which is called as the hyaluronic acid. And this hyaluronic acid has got properties to bind with water. Therefore, this makes this binding capacity, this hygroscopic nature of the hyaline cartilage makes it spongy, it makes it smooth, and with the synovial fluid, it makes it slippery. "30 times more than skates on ice." So this is called as coefficient of friction. Now this mechanism of lubrication is that if there is slow movement, then from this bone and this cartilage, water molecules will be squeezed from pressure bearing areas. Supposing this is the pressure, so there will be squeezing of water molecules, and this surface of the cartilage because of the squeezing of these water molecules will never be able to come in contact with this. This is called as elastohydrodynamic lubrication. It is because of the elastic nature of cartilage. The second type of lubrication is that if there is fast movement between the two cartilage surfaces, surfaces, then the viscosity of the synovial fluid, which is in between, this viscosity prevents this synovial fluid from escaping between them. It doesn't move easily. So this viscosity, this is known as hydroplaning. If your car is very fast and there is water on the road, then the tires are not on the road, they are on the sheet of water. So that is called as hydroplaning in the normal sense, but that is called as hydrodynamic lubrication. So this is basically the function of cartilage. Now the cartilage is always being rubbed off. So if here is the cartilage, it is always being rubbed off. So there is always a loss and there is always production. Now this production is by chondrocytes. And these chondrocytes would produce the matrix. So this matrix would consist of
collagen,
collagen, glycosaminoglycans, which connects this collagen with hyaluronic acid, which would bind water. Now these chondrocytes receive nutrition from, if this is the bone, then there are end arteries like this, showing hairpin bends. So some of the nutrition would to the chondrocyte would certainly it's supposed to diffuse from the subchondral bone. So some nutrition will go like this, but the other will come from the synovial fluid. So then some nutrition would also come from synovial fluid. And this is because of movement or pulsion pressure. So if there is a joint which doesn't move for a long time, as in policeman, then this sort of nutrition starts suffering. And what basically happens is that glycosaminoglycans is reduced. Collagen changes from 6 to 4 to 6. Hyaluronic acid decreases. Water retention becomes less. Cartilage becomes pale. Looks fibrillar. Turgor is lost. That means compressibility is lost. And it is prone to get rubbed off. In pressure bearing areas. In pressure bearing area, this cartilage is rubbed off, and when it is rubbed off, it forms what is called as detritus, which floats in fluid and rubs off more cartilage. Then, because of this rubbing off, the subchondral bone is exposed. And this leads to, this is called as hibernation. Then if this is the subchondral bone, then the subchondral bone has got fibers like this, mineral deposits like this, and in between there is less bone. So what happens that this fibrillar nature of the subchondral bone, there are micro fractures, and this width of the subchondral bone becomes lesser and more sclerotic. So this is subchondral sclerosis. And sometimes there are cysts that appear in the subchondral bone, So these are microfractures and subchondral cyst forming. So in this happens in the pressure bearing areas, okay, where there is pressure bearing area. So there's pressure. In non-pressure bearing areas, whenever the chondrocytes get anoxic, they cause the blood vessels to enter the cartilage. And you must remember this, if this is the blood vessel, these are the endothelial cells, and they have entered this cartilage. They have entered this cartilage. Then these endothelial cells will convert into stellate cells, with central nuclei, granular cytoplasm, which are called as osteoblasts. These osteoblasts will start secreting, will lay down matrix, bone matrix, that means osteoid. And they will release alkaline phosphatase. The alkaline will convert the medium into alkaline. And you know that calcium, ionization of calcium would decrease in alkaline medium. Alright? Because the pK of cartilage is acidic. So it is, let us say 4. In 4 the ionization is maximum. So if now the pH is 8, then this ionization would decrease. Okay? So alkalinity causes ionic calcium to convert into mineral calcium, and it searches an ion which is called as HPO4. So what it immediately becomes calcium HPO4, which is mineral. So mineral matrix and mineral colloid means ossification, means osteophyte form. Correct? So this is the basic pathology that is occurring, and this pathology is precipitated because of overuse, because of injury, because of stress, because of disease, and basically this less area, more pressure, long time. Correct? And also, if the cartilage, if the force is not perpendicular to the cartilage, then there is what is called as shearing stress. So this is how the cartilage is overstressed and it becomes osteoarthritis. So decrease weight, increase muscle protective effect, transfer weight elsewhere, that means walking stick, or heel raise. If you give a heel raise, knee will flex, weight bearing axis will change. ठीक है? Decrease inflammation. Inflammation is decreased by NSAIDs, by local PRP or growth factor, right? Or even depomedrol steroids. Okay. So these are lifestyle modification. Up to here. Then, in this particular case, you will correct angle by a high tibial osteotomy, and it is also corrected by fibulectomy. Fibulectomy may also correct that 2 degrees or 3 degrees of varus. Okay? Fibulectomy is far simpler, much easier than a STO. Then you have to wash out detritus. This is arthroscopic lavage, or you have to deal with pain points, peripatellar pain points, that is depomedrol, xylocaine, and CRP. Then you have to deal with cartilage loss. So no known procedure can produce hyaline cartilage. Hyaline cartilage not possible. Not possible till now. What will be produced will be fibrocartilage. So, in areas of hibernation, you could puncture the subchondral bone, rub off the pathological cartilage and puncture the subchondral bone. Correct? Then you can give drugs like chondroitin plus glucosamine, but meta-analysis has not proved this to be effective. Okay? Then even experimental cartilage implant has been tried, but effective efficacy is not proved. And if everything fails and there is a lot of disability, then you do a total knee replacement. So this is the management of osteoarthritis of knee. It is about 90% of the population above 50 years have it, and it's an epidemiological problem in this country, and we must find out ways to treat it cheaply, effectively and cheaply. So this is it.